thank you very much for joining us for the Latin America update for March. We welcome your participation. This event is being recorded. It's also being streamed live on Facebook. And on behalf of the Center for Latin American Studies, we want to thank first and foremost our panelists, Lisa Newman from the University of Pittsburgh, John Folga Hasimovich from the United States Naval Academy, Lucia Dammert, a visiting scholar at Harvard and from the University of Santiago in Chile, and Priscila Castaña, who is also from the University of Pittsburgh. Today we wanted to share with you an event that had been previously planned, but because of the current circumstances in the world, we postponed for 1 week, and we are now doing it entirely digitally, virtually, via Zoom. I hope that that you all feel that this event brings to light some important issues in Latin America, current issues in Latin America, and as well, we hope that you feel free to ask questions. The Zoom application, you will notice, has a group chat where you can type your questions. And depending on the number of participants in this meeting, we have space for up to 300. Depending on that number, we may actually have the ability to have you ask the questions live with your video feed and your sound off. The moderator, actually, both the co-hosts is what I should say, Jessica, Kraft, and I have the ability to mute and unmute anyone. We request that people are considerate and all in terms of the time and in terms of the tone of the questions. We know that some of these issues can get very heated, especially as it concerns Latin American countries that we care very much about. And I just want to say thank you for being part of this. And with that, let me start out in the way that we thought about this meeting is the very large and very obvious issue for all of us is the COVID-19 crisis, the coronavirus pandemic. And our focus, being the Center for Latin American Studies, is to think about Latin America in that context. But we also want to bring to mind some issues that will linger even after we overcome the crisis. And these have some political and economic and democratic impacts for perhaps a longer term than what this health crisis will mean. So that put together with the politics that are sort of par for the course for Latin America could mean very significant impacts in our lives in this hemisphere. So before we were faced with this, the social distancing and the changes that the fabric of our societies is going through, one of the things that seemed very obvious to us was the situation in Chile with a constitutional referendum to be, that was programmed to take place in April. And I wanted to ask Lucia Dammert and to start this off, is that still programmed for the same date? Are there plans and are there modifications, and what will this mean if it happens in the situation we're in? You're on mute.
Yeah. Hi, everybody. Thank you for the invitation. Of course, this is a very interesting, yet difficult time for Latin America and the world in general. But for Latin America, after like 6 or 7 months of constant social crisis, a lot of social protests on the streets, and a political crisis, and in some countries, economic crisis either. And now we are facing this pandemic. So in the specific case of Chile, Our referendum was agreed to be implemented in April of this year. However, since the whole country, even we don't have a lockdown now, but the whole country is preparing itself for more aggressive measures towards the COVID-19 pandemic. So the whole constitutional referendum has been postponed all the way to October. That makes, you know, a lot of changes in terms of the electoral decisions. So not only the date of the referendum was changed, but also a lot of other electoral processes. What is good is that yesterday, the law that obliges us to have a 50-50 representation in the new Constitutional Assembly was actually printed. So there were some questions whether, you know, that law would be actually enforced for the next referendum. And as you probably know, Chile will be the first country, I think, in the world that will have 50-50 women-male representation in the Constitutional Assembly. There are lots of elements that has to be further discussed, such as indigenous representation, what happened with independent people who are not part of a political party. But let me tell you that the whole political discussion that was very much focused into social unrest, social conflict on the streets, the whole criticism against the neoliberal model, and all those elements are basically gone now. And mainstream media, politicians, and citizenship in general, we just moved into the COVID-19 area. But I just want to say something. With that COVID-19 discussion, we will continue discussing the importance of the state and the crisis of the neoliberal model, a model that actually left the private sector to run health issues. So it's not like we just, you know, we went apolitical. That would be a mistake. We went political, but through this health situation.
In terms of the alignment and the tendencies, obviously it sounds like, much like so many countries, the focus and the attention is being devoted, the energy is being devoted to overcoming the crisis. But in terms of the tendency or the effect that this crisis might have in the future, alignments, the number of people representing, the inclinations of those people representing, how do you see that changing after this?
Well, that's a thing that will change everywhere in Latin America, because it would depend on how good or how bad the president and their government actually faces this crisis. There are a couple of things that are interesting. One of them is that the popularity of the president, Piñera, who was down on 5%, now is around 18%. And perhaps it went up a little bit because he is, you know, presenting himself and his government as, you know, preparing and being preventive, even though there are huge discussions here on health policies. But I think that in Chile and throughout Latin America, nothing is, you know, written in stone right now, because the next couple of months will define the whole political spectrum. I mean, if the President Piñera actually faces this crisis with a sound public policy initiative, with preventive measures, with a lot of money for the economic crisis that will develop later on, perhaps he will be better than previously, like 2 months before, right? And that's I can see that happening also in Argentina, in Peru, and many countries. So it's interesting how this virus has become, you know, a key political actor in terms of the next Latin American scenario in general. And as much as we see Andrés Manuel López Obrador or Bolsonaro in Mexico and Brazil, you know, just rambling around this issue, I'm just wondering how much impact would have on the electoral. Here in Chile, it's going to be huge.
And you know, and that is really interesting in terms of the leveraging that a crisis allows for leadership, right? And sort of the jockeying for position and sort of being able to assume a role with very little contestation, right? That would have not been possible or even imaginable, 3 weeks ago.
Yeah, that's right. I don't think this is only a Chilean situation. I think it's, you know, it's throughout the world. I mean, just look at what is going on in the US with Donald Trump. But in Chile, that we faced almost 4 months of social protests on the street, daily social protests on the street, a government that was almost, you know, unprepared to face these issues, a citizenship that was almost focused on how to change the constitution and the neoliberal model at its core, not around it, but really at its core. Now the whole discussion has really shifted. And one of the questions that we will have to wait to answer is, if the, you know, after the coronavirus pandemic goes through, how are we going to be able to change the focus into a policy that will go back to changes, to, you know, to structural changes, or perhaps the huge economic crisis that we are going to have in Latin America and in Chile specifically will actually move us toward a different, you know, river. So we really are, you know, in a earthquake mode right now.
And in that respect, you know, I wanted to, John, perhaps ask you, in terms of how you see Dear Venezuela reacting, and what are news, how is the government sort of poised to deal with this? What is public opinion? You know, it's a country that we hear about quite a bit here and there, but not in these times. There's a lot less information, for example, about Venezuela than what we hear in other countries where there seem to be more active roles.
Sure. I think that looking at the panorama of Latin America and the response to COVID-19 right now, you go from the good to the bad, and I'm sure we're going to talk about that, with kind of the worst countries being probably Nicaragua, Brazil, and Argentina, like Lucia just mentioned, with leaders encouraging people still to go out to restaurants and to get together, and essentially not encouraging self-quarantining at this point. And then other countries like El Salvador and Peru and places like that, Argentina, where leaders are taking very seriously the threat. And I think Venezuela falls somewhere in the middle. But ultimately, the political leadership in Venezuela is severely hampered by the fact that there are two people contesting the presidency. So at first, Nicolás Maduro did not appear to take seriously the threat of coronavirus. And then over the past week has given public declarations for people to be careful, to stay inside, and things like this. But this is going on amidst a profound economic crisis where people were already finding it difficult to put food on the table and to get medical care and things like this, right? So meeting their very basic needs. It's difficult to imagine a scenario where coronavirus doesn't totally decimate Venezuela, to be quite honest. And so that's like the baseline. Adding on top of that, the fact that last week Maduro asked the IMF for a $5 billion emergency loan. But the IMF denied that request because there was, quote unquote, no clarity as to who the country's leader is, whether it was Maduro or Juan Guaido. Without emergency money and without an agreement between Guaido and Maduro, it's difficult to imagine emergency aid, which needs to come right now, which needs to arrive in Venezuela right now in order to deliver the necessary healthcare for that to have an impact. Yesterday, the European Union, I believe, issued an announcement. I don't have the news in front of me, but the UE essentially declared that they would be in favor of helping out the Maduro government. From the U.S. perspective, that's difficult because the question here is, should the U.S. lift sanctions or not on Venezuela? Since it lifted sanctions, for example, in Iraq, in Iran in 2003, I believe, after an earthquake there. So do those humanitarian concerns supersede the desire to punish those in power in Venezuela, right? So it's, I guess, in sum, a very complex milieu, and I'm not very hopeful about how things are going to turn out right now for Venezuela.
I'm sorry to hear that. I mean, but it's interesting that, how, let's say, the leader of the ALBA countries may finally be coming around, whereas it seems the response elsewhere is much different, especially as you mentioned Nicaragua, where, just last weekend there were people parading on the streets, and they have young people by assignment visiting elders in their homes, and where, basically the media, the Sandinista government-aligned media, which is most of it in the country, is saying, oh, don't worry about this, we've got this beat. I looked at the numbers this morning, and for Nicaragua, there were 2 cases, which is really, really astounding, that they've had at least 2 tests in the country, but they haven't, I don't know how many other people are being tested. I've heard of firsthand relations from people saying that health brigades are going door to door, asking if that they heard somebody had a flu in the neighborhood, because they don't want to. Right now, they're just completely avoiding the possibility that COVID-19 is well entrenched in the country, and that it's a country with a very weak health system, and a lot of people are just wondering what is really going on, what's behind these the president's inclination to go this route and put so many people at risk without actually having a way out. So is this part of a political ploy? Is there a long, is there an end game that is beyond what we can see at this horizon? It's very strange.
Well, just let me say that, coming back, it's a political issue here in Nicaragua and everywhere. The most important thing of what John said to me is that, Venezuela has a huge migration group of people migrating to Colombia, going perhaps to Brazil. I'm just wondering how this lack of health policies will affect or will push more people, moving out of Venezuela.
I absolutely agree, and I think that countries now have begun to take measures to close borders, and that's the case with both the Colombian and Venezuelan government, that they've closed their border ostensibly to prevent migration, but ultimately I think that is a move that could backfire and be more dangerous. It's not going to stop people from crossing. It's just going to make the crossings more difficult. and potentially risky, not just for those people, but for the populations where that are ultimately their destinations.
Yeah, and John, last time we spoke about Venezuela in January, one of the one of the salient features of Cuban cooperation was all the medical personnel, right? And I am wondering if they're staying in place. Are they going back to Cuba? Do you know what's going on with that?
I'm not sure what's happening with Cuban medical personnel in Venezuela right now. I know that those numbers have dipped quite a bit over the past 5 years, from something like 25,000 to under 10,000 today. And I also know that both Nicaragua and now Italy have requested Cuban medical personnel. So I'm not sure if that's affecting those people that are in Venezuela or if they're coming directly from Cuba.
Okay. Know that, and it's a question to pursue, especially this being a medically centered crisis. Yeah, Lucia.
Yeah, but don't forget that Cuba isn't completely locked down, and they have closed universities, and they have I don't remember the number, but they have lots of tourists, basically stranded over there. And even though Cuba, implemented a huge policy on health sectors, I am not sure if they are really well prepared to face this pandemic. So, of course, doctors are needed everywhere. Nurses are needed everywhere. But I wouldn't say that, there is a surplus of doctors in Cuba now, because they are starting to feel, the gap of numbers. I don't know if they have testers, ventilators, and all those, medical supplies that of course will be needed.
Yeah, and that question of supplies is going to loom large, I think, for Latin American countries, isn't it? Especially because there's so few production centers in that part of our continent, and I don't know about the capacity of mobilizing in the way that, let's say, U.S. Or European centers could. So it's certainly going to be an important issue. And with that in mind, I wanted to ask Licia if you might bring in a bit of the situation in Brazil, especially as it concerns, more vulnerable populations over there.
Right. Yeah, well, I think we all know that this is a completely new situation for like every country. I don't really think there is a country that is completely prepared to manage. And what we are seeing in Brazil is, of course, the complexities, the socio-economic disparities, and, the health situation we had before being the basis for, this huge crisis that is happening now there. And, it is concerning. I think it's always important to recognize that Brazil is so diverse that even though we have a unified public healthcare system, which I think, is being tested a lot with this crisis, and hopefully will be able to demonstrate how important it is for the country. I really believe that a lot of people who didn't value the public healthcare system too much before is now, recognizing that, oh my goodness, the whole country depends on it. Not only the 70% that only use the public healthcare system in a crisis like this, it is the public healthcare system that's really giving, the guidelines and, the infrastructure, most of the infrastructure, and the services and programs that we need. So I'm hopeful that actually this is going to be one of the good outcomes of this crisis, if we can think on some, and I always like to think on some positive outcomes. I really hope people would value the public healthcare system more. So I have been talking to professionals in different cities in Brazil, not in all regions, unfortunately. I would love to know more about, the north part of Brazil and the northeast. I have more contact, in São Paulo and south of Brazil, but I have been in contact with them. And my impression is, I think what Lucia said is very important. In a moment of a crisis like this, people need strong leadership. People really need to know what's going on. They need to have clear information, and they need to understand and clear messages about not only what's going on, but what is expected from them. And of course, there is no denial that this is affecting the whole country tremendously, and not in an even way. Those who need to work to get the money to pay the bills every day and now are stuck at home, or not being able to go anywhere. So of course there is greater impact in the more vulnerable population and also the older adults. But what I have seen that I'm pleased to see is that the Ministry of Health has really taken the lead. About 10 days ago, I started receiving, videos of representatives from medical societies who were called to go to Brasilia and meet with the professionals from the Minister of Health to discuss how they would coordinate. For what I learned from their videos is, I think the main purpose of the meeting was to have everyone on the same page, which I think is fantastic and very needed. And then to also coordinate the protocols and the communication, how they were going to communicate to the society about what was going on and what should be done. And when you browse to websites of different medical societies and NGOs and government departments at all levels, you see quite a consistent, group of messages that they are replicating. And I think this is fantastic, because we are talking about prevention at this point a lot, and we are try to avoid the transmission of the virus. We are talking about asking people to change their behavior, and everyone who works with public health and population health know how hard it is. And if you don't have strong leadership and clear messages, this never happens. So I see this as a good thing, even though like at the local levels, you see different things being implemented. In general, the guidelines are clear. So I think that's the good thing about what's going on. And unfortunately, for what I have talked to some people, they are saying the worst part is still to come, and they are aware of that. So even though we see the numbers of cases increasing, the number of deaths is increasing, with the cases getting, not only spreading more, but you're having more severe cases, then all these concerns about infrastructure, healthcare capacity, from equipment to personal protected equipment, which I think is a great concern. All of this is actually worrying a lot of people, because as you said, most of this equipment and products come from overseas, and with the boundaries closed, the borders closed, then how you're going to get access to that, and then every country is now in need of them. So there is all that concern.
Yeah.
You're right.
And before I would like Priscilla to respond, I wanted to ask a question that I'm sort of echoing John on, and it really seems like there's different responses in terms of governors to the crisis in Brazil, which may or may not be in step with the president. But it also seems as if the president is in his bubble, and then I'm not sure if the right word is allowing, but there's a lot of other work that's happening despite whatever his inclinations may be. And so, just wondering, how this interplay works, where it's a United States, a federal, organization, right, just like the United States. And so how does that sort of the central federal government play a role in terms of sort of local state response.
Yeah, I think
Go. Sorry, I saw. Go ahead.
Yeah. Before I wanted to get to Priscilla, I wanted to have Licia respond.
Oh, okay. So I'll answer this, Priscilla, and then I'll pass the ball to you. Well, Manuel, you're right. The way our healthcare system is organized in Brazil is, yeah, you have the federal government like dictating the policies and like not dictating, creating the policies, many cases in partnership with state and municipal representatives, and then it's implemented. And we tend to say it goes all the way down because the idea is that the municipal government is on the front row, is the one like responsible to really implementing everything, unless the municipality is too like it's too small, then you need a greater partnership with the state. All of that is there, like this is how it's structured. In this situation, what I have noticed is that you were right. I think the president is at least allowing the Ministry of Health to take the lead and to set, policies and coordinate with the states, despite some political issues that they have. I'm not saying this is not happening. I see the technical work, like the health work, kind of like winning in this battle with like politics and in policy and politics, which in Portuguese is one word that always creates confusion. People mix them up a lot. So
Maybe it's the source of all the problems.
I know. But what I have noticed is, that the Ministry of Health is representing the federal government a lot. We also see some movement on the Ministry of Economy with this less decisions of transferring money from one fund at the federal level to the state funds and then to the municipal funds, because this is how healthcare policies are funded. So the ministry, again, not the president itself, he is allowing for the ministries to kind of like be in front. And you see that even in some lives that they seem to be taking the lead. And I think it's great. And we see some governors also like taking action, having, open communication through lives and interviews and saying in our state, this is needed and we needed to do it. So I wonder, you were talking about what's going to stay, like what's going to last after all this crisis is gone. I wonder that a lot, because I personally believe now it's not time to take sides. Like, I think we need to coordinate. We really need all sectors, like and all levels of government to work together on this. And hopefully by learning to work together for the common good, we'll have something that stays, afterwards, and people can build on that. I think, I have seen some important changes in policies that were the result of society pressures. One example, and I will only say this now, is it was approved the use of telehealth in Brazil, which has been a big movement, like parts of the society, pushing for that, and other societies, clinical societies against that, and government kind of like trying to manage that. So it wasn't approved until now. And now they approved, saying it's for the period of the crisis. I really hope it's not only for this, but I hope that they will learn to use this, because it's an important tool. And it's not time, again, like to have the sides battling each other because of their, individual beliefs. So.
Yeah. In that respect, this is, that is why I confused the request before, and I was telling Priscilla to asking her to respond to something that you said in terms of the resources that are being devoted, the way those resources are being focused, the capacity to actually make those resources available where they're needed. Priscilla, in that respect, I mean, what are you seeing in Brazil, and what do you foresee?
Yeah, it's in terms of resources, it's kind of hard to talk about because all countries, like this is a worldwide problem, will face like lack of resources to deal with that outbreak. Um, One thing that is clear, at least from the perspective of like an epidemiological perspective, is that if you test more cases and if you implement measurements like social distance, you are more likely to succeed and to, you know, stop the crisis like faster. Um, in Brazil, we have like around 14,000 beds of intensive care units. And if you think about the Brazilian population, even of like the smaller cities, we know that that's not going to be enough to deal with the crisis. And I think adding to what Licia was saying in terms of like the measurements that are being taken in Brazil, I think the Minister of Health, like, despite all the crap that the president is talking about, you know, and living in his little bubble and then saying, oh, this is just media propaganda, this is a fantasy, this is just like a little virus. I think the Minister of Health has been able to, you know, keep it together and really like give the directions and try to kind of coordinate how to allocate those resources for the places that need. But I also think that there has been a huge responsibility in the state and in the local like governments to actually deal with this crisis because of the lack of a strong, you know, national response to deal with this crisis. And in major cities, you have seen things like that, like the local authorities, the government, the governors and the mayors trying to actually work together. I'm from Northeast, and then I have been following that closely, and they are like packing together and then trying to go and then ask for help from like other countries, ask for help for the Minister of Health, and then trying to really say, hey, we need this, this, and that. And also trying to call the society to also help and then donate so they can actually acquire like these resources like masks and then also money to test more patients. And they have been playing like, I think, a huge role in this crisis and trying to really deal with the lack of response from the, you know, from the president. But one thing to me that's not clear is how, you know, the low income neighborhoods is going to deal with that, because we have been talking a lot about like social distancing and washing your hands, but you have to think about like there's a huge population in Brazil, at least, that lives in favelas, and they don't have regular access to water, to running water, to soap. How they're going to implement social distance, how they're going to be constantly washing your hands, and how are you going to deal with this outbreak, this epidemic, when it gets to those places. And I think there has been very little talk about that, both locally and nationally. In terms of resources, it's complicated because you need money, so you need to allocate money to actually buy and then, you know, distribute those. And we also have a problem with supply right now because we don't have enough, you know, companies making masks to sell to the entire world, so they can actually get that and, you know, give for the people who need, for the healthcare workers, for patients that are, you know, symptomatic. So that's going to be a little bit complicated to do, but not only in Latin America, but throughout like the world. We have been seeing that here in US as well. So
I'm sorry, I was on mute. Yeah, sorry about that. So in terms of, you know, as you were saying that, you know, this is a worldwide crisis and there's not enough production to really deal with the needs, the demand everywhere. To what extent do you sense that, you know, sort of price competition? I know it's not necessarily your area, but you know what, are things I mean, is it such that other countries might pay more for the same things, and so a country like Brazil might lose out?
Yeah, I don't know if I feel comfortable to talk about that, because I've seen a lot in the news, this kind of like stuff, like in Brazil itself, not competing with other countries, but in the country itself, like you have like smaller companies and larger companies that like increasing the price of masks, for example, and then selling that for the government and for the state, and then some like because now we have a state of emergency, you can buy, you know, anywhere without really checking the prices. So some companies are being more keen to sell because they have contacts with politicians and this kind of stuff. I don't know to what extent that's true or not, so I rather not really comment on that, but I doubt that that's for sure is happening. So
And in terms of the testing that's going on in Brazil, what do you know, I heard really, this is like ancient history, but about a week and a half ago, that the government was actually being proactive in testing, and that they were doing a number of tests that were they were actually not shying away from that, and so that the number of positives relative to the number of deceased may be an accurate representation of what's going on. Is that your sense for Brazil?
yeah, I think in the beginning they were trying to test as much as they could. I think they were really effective. Some of the places in testing it, at least comparing to here. And I think that has to do with the fact that Brazil has had other like huge outbreaks. We have like dengue outbreaks, Zika outbreaks. So we have a larger, not capacity, but we have this sense that we need to test, we need to screen, we need to have an idea of the amount of symptomatic people that is out there, or people that is transmitting the disease that is out there. So they did, I think, a good job in testing a lot of people. Right now, they're trying to reduce, and they just try to, because we're right now in a phase where you already have local transmission. So the idea is to try to test just the ones that are really with a more severe symptom, or healthcare workers, instead of like screening the entire population. But they did try to acquire new technologies. That I heard about that yesterday, talking to some researchers at Fiocruz in Recife, and they were talking about that the Ministry of Health is acquiring a couple of new novel assays to try to implement like a serological screening. So I think in this regard, they're doing well, based on the capacity and the resources that they have right now.
Okay. And, you know, and this brings up another question for me, and Alicia, in terms of the population pyramid by, in terms of age and let's say vulnerable populations, as we know right now.
Mm-hmm. Yeah. So that is, we all know, like, you know, a population that is more at risk. And
how is it poised?
so we have about like 30 million older adults, people over 60 in Brazil. And it's important to say, especially for people from outside of Brazil, that only about 1% of older adults live in nursing homes. Most of our older adults live in the communities. They live with their families or by themselves, close to their families. It's part of our culture to kind of like embrace our older adults, right? A few years ago, I went to Brazil and I did research exactly on that, on low-income communities. And so the main concern is to try to keep this population as healthy as possible, you know, considering that most of them already have comorbidities, you know, chronic disease. So try to keep them as healthy as possible in their own homes. Try to avoid to bring them to hospitals or clinics. So one good thing that is happening, which I think is very important and show that, you know, governments are tuned to the fact that this population needs care, is the fact that they decided to anticipate the vaccination for the flu in H1N1. And I have to say, I was very concerned about that. When I heard, I was like, oh my goodness, like we are trying to keep these older adults at home and now you're taking them out to get the vaccination. But then I talked to some health professionals, and what I understood is that they expect that the COVID is still going to get worse. And as it gets worse, we are going to have the flu virus. Well, then Priscilla can talk more about it than I can. In the air, and they are trying to find a way to make sure they kind of like isolate the problem on COVID. So if older adults show, not only older adults, they started vaccinating older adults, but that if the people start showing other symptoms, they can at least know this person has been vaccinated to H1N1, so it's not that. We should consider there is a greater chance that it is COVID. So like trying to make it clearer. But one good thing that they are doing is they are creating innovative ways to provide vaccines to older adults. So I know in my city, Curitiba, they created drive-thrus. So people come with their cars and they're vaccinated in the car, and then the person goes. And I know of some people who actually took their parents this way and they felt safer. I don't think it's completely safe, but I think it's definitely much better than have older adults going to health clinics and hospitals. So another thing that I actually received was kind of like a guidelines, a simple guide for nursing homes. So a group of professionals from different universities and gerontologists and geriatricians got together and created this document with simple guidelines for quality and safety in nursing homes. And this is already being disseminated, and people are saying, please help this to get to all nursing homes. And I took a look, and it's very objective, and they talk about, you know, what volunteers should do, what health professionals should do, what families should do, and, you know, what should be, and how things should be communicated to older adults. So they give lots of ideas on how to do it, how to talk about this crisis, how to talk about the changes that, of course, the elderly is noticing, and not everybody understands what's happening. So like I felt it was a good way to at least, you know, acknowledge the importance of, we don't have too many older adults living in nursing homes, but those who are of course, you know, disconnected, and will feel more disconnected now that they cannot even receive visits from their families and friends. So there is like some movement in that side. It's of course concerning, and I think Priscilla is very right when she says we still need to hear more about what's being planned for favelas and, you know, other communities where we have a concentration of people living in vulnerable situation because of health conditions, because of socioeconomic conditions, and, you know, some lack of basic infrastructure. And yeah, I haven't heard much of that either.
Yeah, and actually, I'm curious, Lucia, in terms of vulnerable populations in Chile, what is your assessment, you know,
Well,
in terms of people's behavior?
Well, I think that what Alicia said is it could be applied for almost everywhere, because this is a pandemic that, at least in Latin America, started by those who actually travel abroad during the vacations. So the well-off, you know, the people who actually have a private insurance or private health programs, as soon as they arrived, and this is an issue that we can, you know, discuss in a larger moment, but as soon as our elites arrived, because they feel entitled, you know, they decided to just go on the streets. They decided that perhaps this is not such a huge of an issue. So now in Chile, you have like 50% of cases were very much located in 3 specific neighborhoods, where the people with the better off socioeconomic situation lived. And of course, that is nowadays the problem. The thing is that since social distancing has not been in place, really, and we just have a toque de queda, you know, a situation for nights with the military on the streets, what we are fearing is that in a couple of weeks, we will have more and more people being, you know, with symptoms in other neighborhoods. And the government is trying to organize to tackle that. But the fact is that Chile has 1,000 ventiladores, 1,000 respirators, right? In the public system, and in the private sector, like 800. China has donated 1,000 more. But we have, since 1990 all the way here, we have, you know, strengthening the private sector, the public-private sector, the private sector, I mean, and our public sector is not as strong. So there are huge questions on how we are going to be able to provide for good health, better care, and, you know, preventive measures for those who cannot stop and just telework, who have no internet, for those students who will be out of school because they have no way to get in contact with professors. And, you know, even though universities are closed now, most of them are having, you know, online classes. But who is really being able to get into online classes? Only the better off. So that's why I said at the beginning that after this whole crisis passes, I'm pretty sure the whole criticism against the neoliberal model, against the highly privatized, you know, educational and health system will come back.
Oh, certainly. And you know, when you talked about that dynamic, I just thought about all the people who are domestic workers, who, you know, are living in elite households and who go home, or whenever they do, to their impoverished, typically impoverished neighborhoods. And
yeah, people working on supermarkets, you know, people working on the streets. I mean, there is lots of places that they can be contaminated. And nowadays, I think that in most countries in Latin America, the focus has been on those who actually are sick, who are the better off. So what is going to happen in 2 or 3 weeks? I think Licia and Priscilla, you know, they pointed on the specific important issues.
Licia and Priscilla can also probably talk about this already happening in Brazil. With everyone around Bolsonaro apparently has coronavirus except Bolsonaro, right? I believe his driver just tested positive, but also the case of, you know, this very wealthy family who didn't let their maid take off, and she died already from COVID-19. So what Lucia is talking about has already happened, has already begun to happen, right? I wanted to interrupt because I have so little to add to the health aspect of this, because I'm not an expert the way the rest of you are. But I wanted to add a couple, just two very quick possible political repercussions from this, because I'm a political scientist. I'm thinking about the political aspects. Two things that we've already seen that I think are very worrying for the region, and I guess worrying for the world at large, but this being Latin America, the two things are, first of all, concerns over limiting civil liberties, right? So governments using the guise of COVID-19 to limit the civil liberties of their populations. We've already seen this happen in Honduras on the 16th. President Juan Orlando Hernandez published a decree that instituted a state of emergency for 7 days, which I'm certain was renewed, imposing a curfew, revoking articles of the Constitution, including protections over freedom of expression, right? So this is already a president who has shown to be quite anti-democratic, and seems likely that he won a fraudulent election. And so, you know, is COVID-19 serving as a way for him to limit the rights of Hondurans? So I think that's a salient concern. The second thing is the postponement of political events. As Lucia, you know, opened up talking about, the Chilean constitutional plebiscite was postponed basically 6 months from April to October. So what does that do in Chile? And she can obviously speak about that, but it's not just Chile. In Bolivia, 2 days ago or something, the Bolivian Electoral Tribunal announced that it had suspended the electoral calendar there for the presidential elections to take place on May 3rd. And so right now, the idea is that there will be a 14-day national quarantine, and then that will be pushed back. The elections will be pushed back till sometime in mid-May. But there are no guarantees. Furthermore, the party of Evo Morales, the MAS, was the only party that was not consulted on this decision and does not agree with the decision to postpone this. So the question is, will this delay stir up tensions in Bolivia, and how might that affect the consensus or lack thereof among political elites in that country, in an already kind of very tense situation? And we're seeing this in other places as well, right? Even in Mexico, Congress passed a very controversial reform, and then it closed, right? And so we have to go into self-quarantine. So I think there is a danger of governments taking action that could be anti-democratic under the guise of coronavirus. Thank you.
Yes, I just want to say that one thing that for me also is important, as John said, is the participation of the armed forces in our democratic processes. Nowadays, armed forces are everywhere on the streets in Latin America, enhancing security from El Salvador to Chile and everywhere else. And we are normalizing something that has not been normal. And we are, thinking that it's good to have the military in the street, which is not. And I'm pretty sure that that's another issue that, further on we can say, well, for organized crime, the military, for social protest, the military, so on and so forth. So that's a key issue that also we have to be very much, be focused on.
Certainly. And this is something that we were seeing. It was a big part of our discussion in November, in our Latin America update from November, in terms of the role of the military and how, how it can alter the balance and what role it can play. And I think that this is a risk, not just now, and not just in Latin America. We're seeing this, the same dynamics, where the comparative political science really comes into good use is a lot of the same dynamics are leveraged for similar ends. Well, let's hope cooler heads prevail. It is 1 o'clock. I want to welcome you if you'd like to make some additional remarks. But if you would like to sign off, I also understand. I really am very appreciative on behalf of the Center for Latin American Studies for your time, for your energy, and for your ideas, because especially when it comes to the times that we're living in, talking about issues that are important to us, that would otherwise be important to us, but that gets swallowed up in the news cycle and our local circumstances. I think it's key for our sort of intellectual life and for our well-being. So I appreciate the 4 of you being part of this so generously.
Thank you.
Thank you for the invitation. Thanks, everyone.
My pleasure.
It has been great. Thank you for the opportunity. It has been great learning with all of you.
Yeah. Thank you for the invitation. We should get together soon.
Yes. Let's do that. I agree.
Not too soon.
Yeah.
From a distance, we can do that.
Yeah.
Yes. Thank you very much.